Well, First Lady Jill Biden has tested positive for a rebound case of COVID-19.
She had tested negative over the weekend while she was with the president at their vacation home in Delaware. The First Lady's office says she is experiencing no symptoms but will remain in isolation. She is fully vaccinated, twice boosted, and had been prescribed the antiviral drug Paxlovid. President Biden is still testing negative. Dr. Celine Gounder joins us now. She is the editor-at-large for public health at Kaiser Health News and a CBS News contributor. She's also an epidemiologist. You're so impressive. We love having you here. Just to start off, and I want to talk about Jill Biden. A new study found Paxlovid had little to no benefit for adults between the ages of 40 and 65. We know it has been effective in older Americans, but what would you say to those who are considering taking Paxlovid and may now be hesitant because of this new study?
The FDA, when it issued its authorization, it issued the authorization for people who are older and who are at high risk for progression of severe disease. And I think that still applies. What this study helps to better flesh out is better targeting the Paxlovid drug at those who will benefit the most. And what we're seeing is that if you're over 65, if you're at high risk of progression for severe disease among those who are over 65, it will help keep you out of the hospital. But if you're under 65, there's really no additional benefit.
So for Dr. Biden, I think what we hear happening to her, I'm hearing happening to other people.
Yeah,
testing positive,
anecdotally.
testing negative,
Right.
and then testing positive right away. What's happening?
Well, it's a bit like when you get prescribed an antibiotic, say for a urinary tract infection, and your doctor says, finish the pills in the bottle, finish the course. Just because you feel better doesn't mean you can stop. It's very similar here that you may be feeling better at 5 days of Paxlovid, but it may be that 5 days isn't quite enough to clear the virus. And I think we really do need additional research to help us figure out maybe we need 7 days, maybe we need 10 days. And that research, I think, is going to be very helpful in sorting that out for us.
Because I remember when the president was diagnosed with COVID, one of the things that we had heard about in the briefing room was this notion of rebound cases. That came up as a question. And at the time, I believe what we heard from the doctors at the White House was that essentially the numbers were in like the single digits for rebound cases. But as Nikki was saying, I've heard a lot anecdotally just from people who are under that age of 65, who have had those kinds of rebound cases happen. So it could just be that you're saying it's not that it's not effective, it's that perhaps they just need to increase the time period that people and the duration of people taking Paxlovid.
That's right. And so even among people who are having rebound, they are not ending up in the hospital. And I think that's a really important point. Paxlovid is not causing people to have a rebound. It is still effective in preventing hospitalizations. It's just that we may need to extend the course by a couple days.
So shifting gears, the New York Times reports that the Biden administration could offer the next round of COVID boosters to all Americans ages 12 and up after Labor Day. And these are boosters that would target those highly infectious Omicron variants. I'm wondering, at this point, it's, almost September 2022. Are we overdue for this kind of rollout, and who should get this booster right away?
So the people who should absolutely get a booster right away would be people who are over the age of 50, people who are at higher risk for progression of severe COVID. So that would include the immunocompromised, people who might have chronic heart or lung disease. These are the people who will truly benefit the most, who will be able to save lives, will be able to prevent hospitalizations. Others may also benefit, but that's the group that absolutely should be lining up right away.
The Biden administration has signaled it will stop buying COVID vaccines, treatments, and tests as early as this fall, noting that's when we're going back to school, and begin shifting that responsibility to private insurers. Are you concerned this could lead to another surge if those medications become harder to find or unaffordable for some Americans?
Well, look, Congress has not allocated more money for the administration to purchase more vaccines and drugs. So if there's no money, you can't buy more. And so they're essentially having to turn it over to the regular healthcare system. So who's going to get left out? It's going to be people who don't have insurance or good insurance. And so that is going to mean people of color, people who are lower income. Those are going to be the folks who may have to do without.
All right, Dr. Celine Gounder, really good to have you here. Thanks very much.